everyone. Hello, everyone. This is Dr. Amig, your friendly rheumatologist. And today, I'd like to talk about psoriatic arthritis and particularly the difference between rheumatoid arthritis and psoriatic arthritis. And this is a question that's coming directly from Nora. So just a heads up, this is not medical advice. This is just truly just education. But I really hope that you're going to enjoy all of the things that I have to share with you. All right. So the first thing is that we have to remember that both psoriatic arthritis as well as rheumatoid arthritis are both inflammatory arthritis. What does that mean? So you have heard me say in the past that there is two types of joint pain. There's the mechanical joint pain, and then there is inflammatory joint pain. Inflammatory joint pain, again, there's three components. It's worse in the morning. It gets better with exercise. It's associated with swelling and morning stiffness. You could say that there's four components. Morning stiffness of more than 30 minutes and swelling. And that's different than the mechanical pain that is going to be worse at the end of the day, that is not really associated with any morning stiffness, and that actually gets worse with exercise. Okay. So both psoriatic arthritis as well as rheumatoid arthritis are both inflammatory arthritis. And for that reason, a lot of people may confuse them. And it's even more difficult to differentiate them when psoriatic arthritis does not have psoriasis and when there is no serological manifestation of the disease. So what I mean by that is that it's actually very easy to make a diagnosis of rheumatoid arthritis if your rheumatoid factor and your CCP are positive. Those are serological manifestation of rheumatoid arthritis. Okay, so those are antibodies that you're making, that you can make if you have rheumatoid arthritis. Well, in psoriatic arthritis, we don't have those serological markers. What you may have is inflammation, but short of that, it's really a clinical diagnosis. So how do we make the difference between if this is rheumatoid arthritis or if this is psoriatic arthritis? Well, the first thing is that if you do have psoriasis, most likely you have psoriatic arthritis. It is true that there are some people who have psoriasis, have elevated CRP, elevated ESR, but also have elevated CCP and rheumatoid factor. So in some arguments, some may argue that you may have both psoriatic arthritis and rheumatoid arthritis. And it's really how you're going to manifest your condition that's going to tell us if this is psoriatic arthritis or rheumatoid arthritis, or maybe a little bit of both, really, honestly. So in general, psoriatic arthritis is asymmetric, meaning rheumatoid arthritis is symmetric, affects both the hands, both the feet, and psoriatic arthritis is asymmetric. In psoriatic arthritis, very often you're going to have one finger here, one toe there, maybe one knee here, one elbow on the other side. And it's really asymmetric. And then the other thing that really is different in psoriatic arthritis is that you may have what we call a sausage finger or dactylitis. So it's like a whole finger that's involved. In rheumatoid arthritis, you have only the MCPs and the PIPs of the hands that are affected. In psoriatic arthritis, you have potentially the whole finger. So that is a dactylitis. And it's particularly evident in the toes. And usually if we ask is, have you ever had a sausage finger? And the patients are like, oh, yeah. The other thing in psoriatic arthritis is that you may have what we call an enthesiopathy. And the most common one is at the Achilles tendon. So it's at the back of your feet. That tendon may be painful, swollen, tender, and so on. You may even have had a rupture because of the inflammation. When you have that, you're more likely to have psoriatic arthritis. Some other symptoms of psoriatic arthritis are the back pain, and it's an inflammatory back pain, usually low back pain, right? And that is another argument for psoriatic arthritis. If you have psoriasis, then it's an easy diagnosis. There are other things that are making us think that maybe this is psoriatic arthritis. And why do I say this? Well, because it is possible to have psoriatic arthritis without psoriasis. Yeah, you heard that right. You may have psoriatic arthritis even if you don't have psoriasis. For two reasons. One, the psoriasis may come much later. And second, it's just the same process, except that it didn't involve the skin. So I always tell, and I always make sure, I always tell my medical student, resident, fellows to really take a look at the skin everywhere. Hair, very obvious. Ears, that can be hidden. And then there is the buttock crack where you can see psoriasis, the belly button where you can see psoriasis, in addition to, the elbows, the knees, and just in general, the whole body. And then there is the nails. So you can actually see psoriatic arthritis thanks to the nails. And you will see some punctures of the nails. That's one of the signs of psoriasis. And that is more associated with psoriatic arthritis. Or, as I can see very often with my some of my, I don't want to say colleagues, but friends that are climbers, the toes of your, the nails of your toes can be very abnormal. And I've actually made a diagnosis of psoriatic arthritis in one of my friends who climbed, and he had destroyed nail, and he was like, "Oh, I think this is climbing." But then he was complaining of very painful knee, and it was very swollen. And I said, "I bet this is psoriasis." And yeah, it was confirmed that it was indeed psoriatic arthritis. So the nails are actually really important for us to look. All right, so psoriasis also involves the nail, can involve the nail. And then there are little other things. You can have inflammation of the eye. You can have inflammation of the ureter, which is basically when you're going to pee, it's going to be very painful. You can have some blood in the urine. And you can have inflammation of the gut. So that is that would cause bloody diarrhea. If you have any of this, it's most likely psoriatic arthritis, all right, rather than just rheumatoid arthritis. So if you, like, to summarize this, if you have an inflammatory arthritis and that you are seronegative, meaning that you have neither a rheumatoid factor or CCP, I recommend you get evaluated for psoriatic arthritis and look at the back, look if you have inflammatory back pain, look at if you have any sort of GI symptom, if you have any sort of skin issues, eye issues as well, inflammation, okay? The reason it is so important for us to make a diagnosis is that there is a difference in the treatment of patients with rheumatoid arthritis and patients with psoriatic arthritis. Treatments are quite different. At first, they look similar, but they can be really different if you actually look long-term. And you want to get into full disease remission as soon as possible. So we want to properly treat you as soon as possible as well. So in addition, and so I'm going to just plug this one in, and you know how holistic I am about all of this. There is a direct correlation between adipose tissue and inflammatory arthritis of the psoriatic arthritis. So the adipose tissue is pro-inflammatory, and it's going to cause both inflammation in psoriatic arthritis as well as rheumatoid arthritis. But in my experience, it is much more common to see people who are overweight and potentially obese have psoriatic arthritis. And in my experience as well, when you lose the weight, you actually really help take care of your psoriatic arthritis. And so I really, really believe that anyone that has overweight and has psoriatic arthritis needs to take care of their diet and try to work on losing weight. And it's not the weight, sorry, it's a losing fat cell, losing adipose fat. And it's not for how you look, because I'm absolutely certain you look gorgeous and handsome. It's really just because the fat cell in your case are just pro-inflammatory and causes you to have more joint pain. So that is very important. Okay, that's a lot of information. I really hope I didn't do too much for you, but it's a very interesting question. And thank you so much for asking this question. And I hope this helped you understand the difference and how you need to really ask all of those questions or be asked those questions. Either way, we can get you to remission. Okay. And so if you're looking for a rheumatologist in the Denver, Colorado area, I'm currently open for new patients. So if you're interested, don't hesitate to contact us. I'm very excited to have opened the first direct care / concierge clinic in Colorado. And it will be a pleasure to see you. Have a wonderful day. Take care. Bye-bye.